Well, my parents immigrated from India to the United States, and so I spent my childhood growing up going back and forth to India to visit family with them. And I think through that I grew up with a desire to experience life in other cultures and see the world through the eyes of other cultures from the inside, which is what led me to medicine. And when I decided I wanted to go into pediatrics, I looked for a place where I could get training that would allow me to be the best generalist pediatrician I could be at the time, and would open doors for me to be able to visit other cultures and get to know people in that way. It wasn't very altruistic. It was fairly selfish to start. But the idea was to get out there and see things and really learn people. And so I came here as a resident in 2000. I did my pediatric residency here. I was lucky enough to be a chief resident here. And then I decided that I'd be a generalist for babies. So I chose to pursue a fellowship in neonatology, primarily because the 40 to 50% of all childhood deaths in the world at the time were attributable to newborns. And along with my fellowship, I did an MPH here at the University of Washington in the School of Public Health. And as I finished up my training and really did some soul searching about what would be my next move, it was really nice to be in a place where I felt supported and around mentors who were willing to help me be kind of the best version of me that I could be and not necessarily follow someone else's path. And so I had an opportunity to be involved with developing a training program for residents who wanted to be what I had wanted to be when I came. And so we launched a global health education track within our residency back in 2008 when I joined as an associate program director of the residency. And I haven't really looked back. I spend now about a third of my time taking care of sick newborns in the intensive care units of the University of Washington NICU and at Seattle Children's. And I spend about a third of my time in the residency program, still involved with our global health pathway. We call it the REACH and KISI program, and involved with other aspects of the educational program. And then I spend about a third, just less than a third of my time doing research. And my main scholarly interests are around trainee well-being and burnout and the learning environment and how it impacts a learner's ability to optimize their performance. Another area of interest is in optimizing newborn outcomes in resource-limited settings through capacity building, specifically human capacity building. And I'm surrounded by just a tremendous group of colleagues and mentors and now trainees. I feel like I'm part of a group, a little army forming that's really focused in this area of work.